Hello aspirants, I am Indamati Karthikeyan from InKar IAS Academy. Today we are going to see about the December 2nd current affairs, and this topic taken from the Delhi edition, the non-communicable diseases. This topic comes under our GS1 urbanization, their problems and their remedies, and also GS2 government policies and intervention for development in various sectors. So why it is in the news? Our cities are spread over pockets and layers. These pockets house the most magnificent, marginalized, and vulnerable urban citizens, such as informal workers, migrant workers. Our city run literally and figuratively because the bike bonnet, gig workers, cab and auto drivers, bus drivers, and also the conductors. There is a need of a create health cities. Marginalized communities and urban neighborhoods must have access of the primary health care. The recent case where a Bengaluru Metropolitan Transport Corporation bus driver passed away after cardiac arrest while on duty has set of discussion on rising poor health outcomes in our cities. How cities shine and are clean because of sanitation workers who are awake before the city does to clean the roads, clear the garbage bins, and transport the garbage of sorting stations, wastelands, or landfills, all while staying deprived of hygiene and nutrition while at work. So most of them are not contract with the without any insurance and non-communicable disease. First of all, we must know what is non-communicable disease. That is it's a growing health problem in India that is contributing significantly of the country disease burden. NCDs or chronic disease that are not caused by infection ages but rather by life cycle and life cycle factors, genetic and also predisposition and also environmental influence. They include conditions such as cardiovascular disease, diabetes, chronic respiratory disease, and cancer. First of all, key statistics and trends about these diseases. Prevalence of NCDs. According to the World Health Organization, NCDs are responsible for over 60% of the death in the India. And also there is a cardiovascular disease account for the largest share of the NCD related deaths, followed by cancer, chronic respiratory disease, and also diabetes. By 2025, it is estimated that NCD will create around 80% of all death in India, posing a major threat to the public health. And also there is a cardiovascular disease. First of all, we must know about that it is a leading cause death in India, contributing approximately 28% of the total death. Thus, such factor is hypertension, poor diet, lack of physical activity, smoking, significant contributors to the rising burden of CVDs in the country. The incidence of heart attacks, strokes, heart failures is particularly high among younger population under 60 years of age, which is concerning the trend. Diabetes is also one of the concerns that is the highest number of people living in with the diabetes globally. It estimated 77 million people are living with diabetes, and the number is expected to rise to over 134 million by 2045. It's a very wide range. That increased prevalence of type 2 diabetes is mainly attributed to lifestyle changes like urbanization, unhealthy diets, and also the physical inactivities. India has become a diabetic capital of the world with a significant rise in causes in both urban and rural areas. So cancer is a similar way major contributor of NCD burden in India. The Indian Council of Medical Research Institute estimate there is a 1.3 million new cases of cancer every year we can found. So it is expected increases due to the factor of population, aging, tobacco use, and also the environmental factor. The most common type of cancer in India include breast cancer, cervical cancer, oral cancer, and lung cancer. Tobacco use remains major risk factor for cancer, particularly oral cancer in India. And finally, chronic respiratory diseases. That is a chronic disease like chronic obstructive pulmonary diseases and asthma are prevalent in India due to the factors such as air pollution, tobacco use, and also the occupational hazards. India has one of the highest level of air population in the world, which was contributed significantly to the respiratory disease, particularly in urban areas. So what are the major risk factors for NCDs in India? That is a several risk factors contribute to the NCDs. That is, first of all, lifestyle changes, urbanization, and changing dietary pattern, including the consumption of processed foods, sugary beverages, high-fat diets, are leading to the obesity, hypertension, and also the diabetics. The physical inactivity is a major concern in urban areas for the sedentary lifestyle has contributed to the rise of the NCDs, and also they can increasing trend of tobacco use, that smoking, chewing remains is a significant factor for various NCDs, particularly cancer, respiratory disease, and also the cardiovascular condition, and also the air pollution also fuel in that is India faces some of the highest level of air pollution globally, particularly in major cities like Delhi, Mumbai, Kolkata. Exposure for the fine particulate matter has been linked to the respiratory disease, cardiovascular condition, and also increased risk of the premature death. And aging population is also one of the risk. That is, with the life expectancy increases, India's population is aging, which naturally increase the burden of the NCDs as they are more common among older individuals. And genetical factor is also one of the role that in the prevalence of NCDs like diabetes, heart disease. The genetic predisposition of certain communities increase their susceptibility to these diseases, and also there is a low awareness and also access to the healthcare, and also many people's underserved urban area lack of awareness about the NCDs. So this is the main thing, so that they can't prevent an early detection to result in the diagnosis of the poor outcome. So we need a early detection, so we need a awareness, and then only we can get to the medical health care. And also there is a limited access to the healthcare. There is a lack of infrastructure for the management, the treatment of chronic disease contribute to the NCD's burden in the India. There were economical and social impact also fueling these things. That is a healthcare cost. The treating NCD is not less, it's a very expensive, and also managing chronic condition places a burden on both healthcare system and families. For example, the cost treating by diabetes, heart disease, cancer lead to a financial strain for the families, particularly in the low income communities. And also there is a low productivity. NCDs have a loss of productivity due to the illness and premature deaths. The impact with workforce, especially as younger adults, are increasingly affected by these diseases. And also there is a development, also one of the impact that India overall development as resources could lead to the goals and diverted towards addressing the health crisis caused by these diseases. And government had made many actions and policy response against these non-communicable diseases. First of all, the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke (NPCDCS) was launched by Ministry of Health and Family Welfare. This program aims to prevent the control of the NCDs through screening, awareness campaign, and also the lifestyle modification programs. It focuses on improving early diagnosis and also management of NCDs. The National Health Policy 2017, which will shift towards the preventive healthcare, it aims to reduce the premature mortality due to the NCD by 25% in the 2030. And also the government has implemented strong tobacco control measures, including graphic warning labels, ban on tobacco advertising, and also smoking cessation program to reduce the tobacco related disease, and also give the public awareness campaigns, that is Eat Right India by Food Safety and Security Authority of India, focus on promoting healthier diets and also the lifestyle changes. And finally, Ayushman Bharat scheme, that is one of the scheme for the health insurance program designated to provide affordable health care to millions of Indians and include coverage for the treatment of the non-communicable diseases. But whatever happening, there is a many challenge behind that. That is that increasing awareness, that the raising awareness about the risk preventive of NCD, especially in rural areas, is very much crucial to reducing the burden. And also there is a strengthening in healthcare infrastructure, particularly for a yearly diagnosed chronic disease management, is essential for improving outcomes. And also we need the lifestyle interventions, that is a public health initiative promoting healthier lifestyles such as physical activity, healthy eating, smoking cessation should be prioritized. And also we need the improving access to treatment, that ensure access to affordable and quality treatment for the NCDs, and also critical management of the disease effectively. These include improving healthcare infrastructure, expanding the reach of specialized care, and addressing financial barriers of treatment. And also we need to integrated NCD prevention into public health care program. That is a primary focus. That is we must take action against maternal and child health, nutrition, sanitation program by addressing risk factors yearly can help to mitigate the future burden of the NCD. So the awareness of the rural and population is a first key criteria to avoid these NCDs, and also to find out in the early stage, and we can actively participate in the awareness program, and we can give the perfect solution for this scenario. Thank you so much.